Hello everyone, welcome to GrowMed. In this video, I will be sharing the questions which were asked in the recent Jan 2024. ठीक है? So not exactly the questions, but I will be sharing the kind of questions and the topic from which the question was asked. Because topic repeat होने के chances बहुत ज़्यादा है, right? तो same question तो repeat होने के chances बहुत कम होते हैं, but it is better that you look at all the points regarding that topic. ठीक है? So let's start. I have already posted the videos of the other subject questions, ठीक है? So you can find those on my YouTube. So there was a question on the spring cataract, ठीक है? तो in question they had described shield ulcer and उसके साथ एक I think केस था, ठीक है? तो 2-3 और चीज़ें डिस्क्राइब की गई हुई थी, बट जो शील्ड अल्सर था ना, वो पीस ऑफ अ केक था, उससे हमको ईजिली पता लगता है कि दैट वॉज स्प्रिंग कैटरेक्ट, ठीक है? देन देयर वाज अ क्वेश्चन ऑन द ब्लंट ट्रॉमा, ठीक है? तो कैटरैक्ट विच टाइप ऑफ कैटरैक्ट इज सीन इन ब्लंट ट्रॉमा, ठीक है? तो रोजेट कैटरैक्ट, तो कैटरैक्ट जो है इट इज़ अ रिपीट टॉपिक. सो हर साल एक क्वेश्चन कैटरैक्ट से, तो इट इज़ अ मस्ट, सो यू नीड टू लुक एट ऑल द पॉइंट्स रिगार्डिंग द कैटरैक्ट, ठीक है? देन देयर वाज अ क्वेश्चन ऑन द इंसर्शन ऑफ द रेक्टाई मसल, द सीक्वेंस ऑफ द इंसर्शन, ठीक है? यू हैव टू चूज द करेक्ट सीक्वेंस, ठीक है? तो 4 अलग अलग सीक्वेंस डिस्क्राइब की गई हुई थी ऑप्शन में. आई डू नॉट रिमेंबर द सीक्वेंस एक्जैक्टली, बट देयर वाज समथिंग अ क्वेश्चन लाइक दिस, ठीक है? देन देयर वाज अ इमेज बेस्ड क्वेश्चन ऑन द मेक person forceps, ठीक है? Identify the following instrument, something like this. Okay, so quite easy one liner. Then there was a question on the retinoblastoma का केस दिया गया था, ठीक है? A child with I think leukocoria and difficulty in लुकिंग, ठीक है? तो ऐसा कुछ केस में डिस्क्राइब किया गया था. एंड रेटिनोब्लास्टोमा यू हैड टू चूज. रेटिनोब्लास्टोमा इज ऑल्सो अ रिपीट टॉपिक, सो यू मस्ट लुक एट ऑल द पॉइंट्स रिगार्डिंग दिस रेटिनोब्लास्टोमा, एंड एवरी ईयर अ क्वेश्चन इज अ मस्ट. सो इन द अपकमिंग जुलाई ऑल्सो यू कैन एक्सपेक्ट अ क्वेश्चन फ्रॉम द रेटिनोब्लास्टोमा, ठीक है? Then the next question, diabetic retinopathy. So question was asked on the non-proliferative diabetic retinopathy. Which of the following will describe severity? Something like this, and 4 options दिए गए थे कि bleeding in 4 quadrant, then bleeding in 1 quadrant, something like that, ठीक है? So you have to choose which of the following will be least describing, something like that, okay? So this is also a repeat topic, diabetic retinopathy. So usually questions proliferative diabetic retinopathy पे ज़्यादा पूछे जाते हैं, but this time there was a question on the non-proliferative. Then again next one repeat topic, optic nerve lesions, ठीक है? So optic nerve, optic pathway, then the nucleus, the rods and cones, ठीक है? So the pathways, the light pathway and their lesions, ठीक है? It is also a repeat topic and a must do topic. So there was a case describing blindness, monocular blindness, ठीक है? And whenever there's monocular blindness, then it will be pointing more towards the optic nerve lesion. Then another simple question, keratic precipitates are seen in iridocyclitis, ठीक है? So iridocyclitis, a type of uveitis. So uveitis also a repeat topic, and questions are asked on this, so expecting a question in the upcoming July also. Then cystoid macular edema, in the question they had described the flower petal appearance, okay? And you had to choose the diagnosis. And flower petal appearance, classical findings seen with the cystoid macular edema. So it was a quite easy and a very simple question, ठीक है? Then senile cataract case, features were described in the case that old patient and photophobia and with double vision. So which of the following will be the diagnosis? So it was the senile cataract. This one also very easy question. Then another very easy question, DCR, dicrocystorhinostomy. This is also a repeat topic, and repeatedly questions are asked on this. So you need to look at all the points regarding this. So the question was asked on the bones removed, ठीक है? So the answer, I think it was the lacrimal bone which is removed. So this was also a simple one-liner, very easy to solve. Then there was a question on the squint. It was an image-based question. Along with that, a case also was described. A small child, and he was having very high accommodation power, and he was wearing his glasses continue, but still his squint was not disappearing, ठीक है? Something like this, and there were options describing what you need to do next, ठीक है? So should you do a surgery, or should you tell the patient to continue with the glasses, or should you switch to some other method, ठीक है? So there were various things described in the options, and you had to choose the best one, okay? Then cataract, another question, ठीक है? So cataract के 3 questions पूछे गए थे इस बार. So as you can see here कितना important है ये. तो you need to look at all the points regarding the cataract. तो usually ना cataract टाइप्स पे एक क्वेश्चन आता है, एंड कैटरैक्ट की सर्जरी पे या तो आते हैं या फिर कैटरैक्ट के मैनेजमेंट पे आते हैं, ठीक है? सो एवरी ईयर ओनली दीज 3 क्वेश्चंस आर These three pattern of questions are asked in the cataract. So if you do all the points regarding the cataract बहुत अच्छे से अगर आप करके जाओगे तो 2 or 3 points are sure, 2 or 3 marks are sure कि आप score कर पाएंगे easily from the ophthalmology. So cataract in a 3-year-old child, ठीक है, and how will you manage it? So usually तो हम surgery ही करेंगे, ठीक है, along with the surgery primary posterior capsulotomy. Okay. So I don't remember the options and exactly what options were given in the paper. So but a question like this was asked, okay. Then for cataract surgery, how will you prevent the endophthalmitis? Okay, so there were options like intravitreal antibiotics or oral antibiotics and IV antibiotics, something like this, okay. So you have to choose the correct option. Okay, so mostly I think IV antibiotics, नहीं, so I think intravitreal antisteroids will be given for the prevention of the endophthalmitis in the cataract surgery. Okay. Then there was a simple one-liner on the malignant glaucoma. Which of the following describes or which of the following is true about the malignant glaucoma? Something like this, and it was the misdirected aqueous flow. And moving on to the next question, there were colored halos in a patient. A patient was old and he was experiencing colored halos and diminished vision. So which of the following will be the probable diagnosis? I don't know which of the following would be the exact answer because I'm getting confused between the open angle glaucoma and the senile cataract. ठीक है, तो ये दोनों ही ऑप्शन में थी and we cannot assume right कि NB के हिसाब से which of the following will be the correct answer. ठीक है, so this was a quite confusing question. Okay, so this was a list on the important and the high yield topic which you must concentrate more for the upcoming FMGE. So I think this video will help you in your preparation. Like the video, share the video with your friends, and if you're new to GrowMed, subscribe and don't forget to tap the bell icon so that whenever I post a video, you will get a notification. Thank you so much for watching this video. Bye bye.